General medicine. Look at this. What is pharmacogenomics? What is its application in medicine? So first let's understand pharmacogenomics. Something genome means you understood, something to do with genetics. Everybody understood. So pharmacogenetics means you will study. Okay, how does paracetamol behave differently in me and differently in you? Or differently in me and differently in a cat, right? So you understood. How does the genetic basis affect the drug response? That is pharmacogenetics. Using this information to prescribe drugs and the dose of drugs is pharmacogenomics. So it is the usage of this information that you learned. Okay, that is what almost with same you can say. Pharmacogenetics, pharmacogenomics. Okay. So where are we now? We are learning about, in the exam they've asked the definition, what is pharmacogenomics? The use of genetic basis of drug response to prescribe drugs and the doses of these drugs is pharmacogenomics. Application of pharmacogenetics is pharmacogenomics. So what you are trying to explain is, if I give the drug to some people, see here, look at this zone here. If I give drug to these people, it's neither toxic and it is very, very beneficial. The drug is very useful for these people. But look at these people here. These people, the drug is not at all beneficial and it is toxic also because their genetics is like that. You understood? Okay. So, based on the genetics, the drug response differs. Did you understand? Based on the genetic behavior, genetic basis, you are prescribing drugs and the doses. Okay, dose also you write. Not just the drug, dose also. Okay, so this is pharmacogenomics. Now they have asked what is the second part of the question? Application in medicine. So you have to give examples where we are using this. Currently not much is happening. Okay. So this much of personalized medicine are we doing? No. That much we are not doing in routine practical application we are not doing. Only the thing possibly we are doing currently is G6PD deficiency, maybe we are checking. Okay. This is the only thing possibly we are checking. G6PD deficiency. G6PD is a good thing. If its deficiency is there, some drugs may work very differently. Only this we are currently doing. Okay, first let us look at this one then, G6PD deficiency. So if G6PD deficiency is there in somebody, okay, G6PD is supposed to be there in you and me and we don't have deficiency, let us say. But if there is deficiency, then some people cannot tolerate some drugs. It will become bad for them. Like Primaquine, which you give for malaria, right? That one, you're right, it can cause hemolysis. Guys, so the first example you have to give. So if there is G6PD deficiency because of some genetic condition that they have this enzyme deficiency, enzyme only, right? What is G6PD full form? We'll write that. Then if they take Primaquine, then there will be hemolysis. What is the bad thing that will happen? Hemolysis. Okay. So there's deficiency of G6PD. If they take Primaquine, they can have hemolysis. Primaquine is given for malaria. G6PD full form I need. Hold on. So it is glucose 6-phosphate dehydrogenase, which is the good thing, but which is maintaining the RBC health and all that. But this one, when if it is deficient, okay, it is X-linked, they are saying. X-linked, is it? So basically RBC, what it will happen? They will hemolyze, they will break. Right? So it is X-linked. If you know this, it's enough. With gene and all, I think not required. Okay. Basically what they're saying you is this G6PD deficiency will cause hemolysis if you take some drugs. Which are those drugs? It's not just Primaquine, guys. You have to write other drugs also. Like Dapsone. Dapsone, I think used for leprosy treatment, right? Then sulfonamides like furosemide, that is diuretic. Hydrochlorothiazide, which is also diuretic. And then cotrimoxazole, which is a trimethoprim sulfa, what is it? Sulfamethoxazole and trimethoprim. Okay. So basically you understood, right? I'm trying to tell you all the drugs that you need to know which can cause hemolysis in somebody. Okay. So you should be aware when you're giving these common drugs if you're giving malaria, Primaquine, Dapsone, furosemide, hydrochlorothiazide, clotrimoxazole. Clotrimoxazole is what? Trimethoprim plus sulfamethoxazole, that is Bactrim and all they call it. Sulfasalazine. Okay. Then if you are giving fluoroquinolones also, they can have, what is that? Guys, hemolysis. They can have nitrofurantoin. Sometimes for UTI you will give, right? So you should know all this. the common drugs, okay, which will cause hemolysis in these people. Okay. We got it right? One example we have finished now. Like this, so many examples are there. Okay, we will tell you some one or two if you can you remember. Okay. One thing they are talking about is breast cancer, guys. The textbook is not talking about this, but some internets are talking about breast cancer. They are saying that if it is HER2 positive, right? If it is HER2 positive, okay, that is that epidermal, what is that? HER means? So if the tumor has this human epidermal growth factor 2 receptor 2, then what will happen? You can give these type of treatments called as trastuzumab, pertuzumab, okay, and TKIs. This is what you can give them, okay. It will be responsive to targeted therapies. Targeted therapy you can give. So this is a good thing they are saying. Okay, one more example you can give. Let's go back to the textbook and see what textbook says. Textbook says that if you give succinylcholine, that is a skeletal muscle relaxant, if you give to some people, what will happen? They can have prolonged apnea. Okay, the relaxant can work longer, which is not good. If they have the atypical pseudocholinesterase, that means pseudocholinesterase is atypical, not normal it is. That time, the succinylcholine, which had to produce skeletal muscle relaxation, will produce prolonged apnea. Apnea means they won't breathe at all, right? Apnea, that is what is apnea, right? They're not breathing at all. So you should be very careful when you're intubating people, okay? And you're giving succinylcholine to somebody, okay? Next, third example that the textbook gives. Let's look at the drug names, guys. That much is enough. Warfarin can behave differently in you and me. Azathioprine can behave differently in you and me. Fluorouracil. It's actually used for cancer treatment, they are saying. That also can cause toxicity in some people based on their genetics. Okay, then move on. Antidepressants can work differently in different people. Codeine. Actually, this codeine, no guys, because of some enzyme in our body, it becomes morphine. That time you will achieve this opioid analgesia. Nice. But some people are deficient of this enzyme, which is converting this codeine to morphine. And that enzyme name is CYPD-D6. Okay. So that time it cannot convert codeine to morphine. So it will fail to produce analgesia. Okay. Then that's all. Okay. So in this video, we wanted to look at what pharmacogenomics is and its application in medicine. So what is pharmacogenomics? Basically, based on the genetics of some population or some people, the drug response will be different. Okay. So in some people, the drug will be good, useful, and some people, the drug will actually cause problem to them. Okay. So the same drug which works for the same disease and this guy won't work in the other guy for the same disease because of his genetics. So what is pharmacogenetics? First of all, you have to learn. It is the study. Study is the word here. Study of this genetic basis of variability in drug response is pharmacogenetics. Application of this information in order to prescribe drugs and dose for an individual is called as pharmacogenomics. Now, this much of personalized medicine we are not doing. The only thing we are doing currently is possibly checking G6PD deficiency. Okay, G6PD is nothing but glucose 6-phosphate dehydrogenase enzyme. This is required for good RBC health. If some people have this G6PD deficiency and to them you give any drugs like primaquine, dapsone, sulfonamides like furosemide, hydrochlorothiazide, cotrimoxazole, which is a combination of trimethoprim and sulfamethoxazole, or if you give sulfasalazine, or if you give fluoroquinolones like fluoroquinolone is what example you give me? Correct, ciprofloxacin, that floxacin, fluoroquinolone, okay? Then if you give anybody nitrofurantoin, that in UTI you might prescribe. So those people might have hemolysis, so you have to be careful when you're prescribing these drugs. Okay, this is the most commonly done according to the textbook. What else is important according to textbook? Guys, we are taking recap. Take a deep breath. G6PD deficiency we have covered. Now look at this. If some people know, you and me have pseudocholinesterase. Some other guy know he has atypical pseudocholinesterase. So what will happen? You have given me succinylcholine and given that guy succinylcholine. But that guy succinylcholine, what it will do? It will produce a prolonged apnea. He won't breathe. You have to be very careful because you did all this for intubation. You intubated me and him, and then succinylcholine effect is gone, but it is not going in him, the succinylcholine effect. Okay, prolonged succinyl apnea. Apnea means not breathing, right? So because he has atypical pseudocholine estrase. Okay, this is important. This is the next important thing. Then warfarin can behave differently in you and me. Azatioprime, which is immunosuppressant, is it? Can behave differently in you and me. Fluorouracil, which is used for cancer treatment, guys, that also can cause toxicity in some people, This is all based on genetics, they are saying. Okay, then antidepressants can work differently in different people. Codeine, it may not convert into morphine in some people because of some enzyme deficiency. So they will not be able to produce analgesia. So you should be aware if you're giving codeine and still that guy is not coming out of the pain, then it can be because that he has deficiency of the enzyme which converts this codeine to morphine. Then one thing the internet says is the tumor, breast cancer tumor, if it is having HER2 positive, that means human epidermal growth factor receptor 2 positive, that means it is responsive to targeted therapies. It's kind of a good thing they are saying that you can all give these targeted therapies for these people, which is nothing but trastuzumab, etc. Okay, that's all, guys. They're like this. There are so many examples. You can look at them. Pharmacogenomics and its use in medicine both covered. Bye.